Hello everyone, today in the part 11 of the NEET quiz important questions, we will discuss about the questions of the topic nose. So just try to first answer the questions by yourself. So first of all, the boundaries of the nose is formed by, the roof of the nose is basically formed by the nasal bone and the frontal bone anteriorly, cribriform plate of the ethmoid bone in the middle, and the body of the sphenoid bone posteriorly. Okay, now the floor of the nose is basically formed by the upper part, okay, or the upper surface of the hard palate. Upper surface of the hard palate basically forms the floor of the this nose, while the lateral wall of the nose is formed by the nasal surface of the ethmoid labyrinth superiorly, perpendicular plate of the palatine bone posteriorly, and the nasal surface of the maxilla lower and anteriorly. So just remember, lateral surface is formed by the nasal surface of the ethmoid labyrinth, perpendicular plate of the palatine bone, and the nasal surface of the maxilla. Now the smallest nasal concha, it is the superior nasal concha. Largest nasal concha, it is the inferior nasal concha. Nasal concha, which is a separate bone, it is the inferior nasal concha. Largest meatus, it is the inferior meatus. What structures are seen under the middle meatus? So very important, gula ethmoidalis, infundibulum, and the hiatus semilunaris are seen under the middle meatus. Which sinus opens into the superior meatus? So posterior ethmoidal sinus. Which structures open into the middle meatus? So they are frontal sinus, anterior and the middle ethmoidal sinus, and the maxillary sinus. Now which sinus open on the gula ethmoidalis? Middle ethmoidal sinus. Now which sinus open on the hiatus semilunaris? Maxillary, frontal, and the anterior ethmoidal sinus basically opens on the hiatus semilunaris. Nasolacrimal duct opens into which meatus? So inferior meatus. Now which artery supply the nasal septum? So they are anterior ethmoidal branch of the ophthalmic artery, septal branch of the superior labial artery of the facial artery, and the sphenopalatine and the greater palatine branch of the maxillary artery. Now which artery supply the lateral walls of the nose? So they are anterior ethmoidal branch of the ophthalmic artery, greater palatine and the facial artery, and the sphenopalatine branch of the maxillary artery. The veins of the nasal cavity basically drains into where? They drain into the pterygoid venous plexus, pharyngeal venous plexus, and the facial vein. Lymphatic drainage of the nose, it is the submandibular and the retropharyngeal lymph node. Nerves supplying the nasal cavity, they are olfactory nerve, anterior ethmoidal nerve, and the infraorbital nerve. Name the paranasal sinuses of the nose. So they are the frontal sinus, maxillary sinus, sphenoidal, and the ethmoidal sinus. What are the anterior group of the paranasal sinus? So they are maxillary, frontal, anterior, and the middle ethmoidal sinuses are the anterior group of the paranasal sinus. While what are the posterior group of the paranasal sinus? So they are sphenoid sinus and the posterior ethmoid sinus. Anterior group of the paranasal sinus drains into which meatus? So they drain into middle meatus. Which paranasal sinus is the first to develop? So it is the maxillary air sinus. Which is the largest air sinus? Maxillary air sinus. Frontal air sinus opens into which part of the hiatus semilunaris? So at the anterior part. Anterior ethmoid air sinus opens into which part of the hiatus semilunaris? So opens into the middle part. Maxillary air sinus opens into which part of the hiatus semilunaris? So at the posterior part. Now what are the relations of the maxillary sinus? So over here in the roof there is infraorbital nerve and artery. In the anterior wall there is anterior superior alveolar nerve, and in the posterior wall wall, that is posterior superior alveolar nerve. Now, where is the canalis sinuses present? So, in the anterior wall of the maxillary air sinus. Now, artery of the nose bleeding, it is the septal branch of the sphenopalatine artery. Very important question. Now, the most commonly infected sinus in the nose, it is the maxillary air sinus. Sinus which develops after birth, it is the frontal air sinus. So today up till here, we'll discuss about the further important notes and the questions of the further important topics in our next video. Thank you so much.